Hello, friends. My name is Dr. Derek Butler, and I'm here to talk about chronic pain management and the struggles we have as providers currently in managing our patients with chronic pain. Now, most of us in our practices, especially even those with patients living with HIV, have a fair number of patients who have chronic pain issues, um, multiple different diagnoses, um, different conditions. um, and have come sometimes with histories of taking chronic pain medications, specifically opioid medicines, controlled substances. And now we have really, I think, a dilemma because we have currently an opioid epidemic that's now been brewing in several parts of the country. And much of that has stemmed from the overprescribing of controlled substances. So, what do we do? Where do we go from here? Um, I think we have to look at the history and myself as a provider being stuck in this. When I came into medicine 20 years ago, we were told and taught to treat pain. It was a fifth vital sign. It was something we had to make sure we manage in every patient. And we were told that opioid medications were not addictive and they were just used for pain. Well, now the pendulum has swung back and we are now in an era of backtracking on that same uh, philosophy. And in the light of the epidemic, there's more scrutiny. And I think sometimes providers now, what do we do? Rather than being shamed for providing pain medicines for patients and now having to implement in our practices, which are probably are definitely useful, tools such as drug screening and checking databases for prescriptions and having patients sign contracts, etc. It's just become much more difficult. And many of us want to shy away from even dealing with patients with chronic pain. And the struggle I have as an HIV provider is I want to make sure I can manage that patient's issues, take care of the HIV, keep them suppressed, and maintain their quality of life, but at the same time now manage their chronic pain. So I bring to the forefront, where do we go? What do we do? I'm a strong believer that not all patients are addicts. Many patients are very functional and they take chronic pain medicines. Um, but I don't want to feel like I'm a villain if I'm writing a prescription for a patient. So let's talk about it.